Hello, everyone. What you see there is the cover of a book that I've read a couple of times. It's been a while since I've read it, but I remember the basic story. What happened is a young woman was vacationing, on the Monterey Peninsula, and she saw a cute little ground squirrel, and it seemed to be sick, and she went up to it. Well, it was sick because it had the plague, bubonic plague. And the plague is endemic in rodents here in California and in, I think, much of the West. What that means is it's always present to a certain degree. Plague cases pop up every once in a while. And if they're caught in time, if they're recognized for what they are, they're really easy to cure. The disease that just wiped out tens of thousands quickly throughout the world is easily curable with antibiotics. Well, she gets bitten by a plague-carrying flea if she doesn't know it. Now, she's sort of in a see America mood, so she decides to take the bus back to New York City, where she's from, so that she can, just watch the scenery along the way. Along the way, she starts feeling ill. And, of course, that's because she has the plague. When she gets home, she goes to her parents' apartment. And one of the things that happens is she, at one point, sort of falls into the arms of one of the employees that work at this apartment. Now, here's the point about this that's very important to remember. This employee was an undocumented immigrant. And he took the plague home to his family. And it spread throughout that particular demographic. Now, that's not the only place it went. This young woman ended up in the hospital. People caught it there. When she got off the bus, a pimp approached her. And I did forget to mention that the plague termed pneumonic in her. That's a different variation. That's where you can catch it by coughing. Normally, you got the average plague is being bitten by fleas, but if it goes into its pneumonic form, if you cough on somebody, you can get it. And that's what happened to the fellow that worked at her parents' apartment. Anyway, so this pimp comes up to her and trying to, pick her up, and she coughs in his face, and he gets the plague. So we end up with an epidemic of the plague in New York City. It's a really interesting book. And although, of course, it is a novel, it is pretty factually based as far as I could tell in terms of what was possible. It was also, I don't know, 20-some years old, or probably 30 years old or something like that. And some of the things that happen in the book might not happen today. I don't know. But one of the big problems in trying to get a handle on the plague was that people in the undocumented community were afraid to get medical treatment. They were afraid to get, that if they went to the hospitals, they would be deported. They would lose their families. The other problem is when the plague goes into a community like that is, these people aren't wealthy. And in New York City, they lived in places where there were lots of rats. And if you remember your history, it's the rats that carried the plague throughout Europe. Now, why am I bringing this up? I'm bringing this up because Jan Brewer, governor of Arizona, has signed an executive order that barring undocumented immigrants who are qualifying for this new temporary legal status from receiving any state or local public benefits. This includes medical benefits. Now, we've had this argument here in California and in other places where people say, we shouldn't have to pay for the medical care for illegal immigrants. Oh, yeah, we should. It was a number of years ago. I don't remember. I tried to look it up But it's very difficult to find news reports on things that happened 20, 25, or even 15 years ago. But there was a cholera epidemic in South America, Peru, I believe. And cholera was brought to Los Angeles. The authorities did a fantastic job of stopping it in its tracks. But if cholera were to get a foothold, that could be really dangerous. If any epidemic or any disease that could cause an epidemic could get a foothold, that could be very dangerous. We have had at times fear of Ebola coming into this country. And of course, as I pointed out, here's the situation with the plague. Some of you may remember when the hantavirus was running rampant on the reservations in the Four Corners area. I don't remember if it was confined to the Navajo reservation or not. The last thing we need to do is to deny health care to anyone. For those people who don't want to pay for it, well, you run the risk of having an epidemic. Currently, we're seeing little epidemics right now of things like whooping cough and measles. And people are dying because of this. Now, this is for a completely different reason. This is because there are some idiots out there who think that vaccination causes autism. All the evidence shows that it doesn't. And the fellow who promoted this did so for monetary reasons. And that's since been proven. But there are still people who refuse to vaccinate their children. And some people might say, well, they're running the risk themselves. Well, actually, no, because children can't be vaccinated up until a certain age. I forget what it is, 2 or something like that. Babies under that age catch whooping cough or measles. There's a good chance they could die, or with measles suffer permanent damage. I have some damage from having measles at a very early age. But the idea, this is so penny-wise, pound-foolish that it's ridiculous. People want to save money by not paying for the health care for undocumented immigrants. When people come into a hospital or a clinic setting, their resident status should be irrelevant. They need to be cared for, and no one should ask any questions, because otherwise they're going to go back to their communities and hide. That is just a great place for the incubation of disease to happen. Anyway, the book that I showed the picture of can be obtained on Amazon, and in many ways I think of it as a cautionary tale, although it is possible that it is out of date. And I just want to point this out because this is beyond the fact that it is heartless to deny health care, especially for children. And it's immoral to deny health care, especially for children. And it certainly would seem to go against Christian principles to deny health care, especially for children. It's also potentially very, very dangerous. Anyway, thank you for listening. Bye.